They're hitting that wall of being burnout, tired, frustrated, and they just don't see an end in sight.
A surge of coronavirus hospitalizations and a shortage of workers is putting frontline workers at the end of their ropes, a problem that may push a local union to go on strike. Thanks for joining us tonight for the News at 10. I'm Meg McLeod.
And I'm David Custer. Some key numbers. Michigan has a little more than 28,000 total hospital beds, with nearly 19,000 occupied, for about 67% occupancy. Those numbers include all patients, the vast majority of whom do not have COVID.
The problem is there are fewer employees to take care of those patients, adding on more work to employees already burnt out without any added compensation.
As TV5's Kendall Keys reports, that's why the Mclaren support staff union is threatening to strike.
It's widespread. It's not just Mclaren, it's across the country.
The pandemic has overwhelmed America's health systems, and hospitals are losing staff left and right.
No one's wanting to actually, it seems like, come back and get into the job market.
And that problem could get worse. Bill Sommer is the president of AFS CME Local 2650. The union represents hospital support staff like nurse aides.
Everybody has sort of forgotten about all the support staff that are in these hospitals providing these services.
The union is negotiating a contract with Mclaren Flint and Mclaren Lapeer, and so far
we're kind of at a stalemate. We just feel like we don't get the respect we deserve as far as all the care and the jobs that we do.
Among the sticking points, the nurse aide to patient ratio.
Normally we would have 3 nurse aides for 37 patients, and it's not uncommon to have 1 nurse aide for 37 patients.
Triple the responsibility, but without a substantial raise in pay. That takes a toll on the employee, Sommer says.
You just can't, accomplish all your tasks in a day when you have 37 patients. They're hitting that wall of being burnout, tired, frustrated, and they just don't see an end in sight.
And he notes a hospital short in staff could be dangerous for patients.
You have a patient that needs assistance walking to the restroom and there's no one there and they're not answering the call light. A lot of times they try on their own. Well, now that's going to increase slip and falls.
The two sides will be back at the negotiating table Monday and Tuesday. If they don't come to an agreement,
if we don't have a contract, we will go forward with a 10-day strike notice.
Kendall Keys, WNEM TV5.
Mclaren released a statement tonight saying it has been bargaining in good faith. It went on to say it has offered significant wage increases depending on classification, appreciation bonuses, and a higher minimum, and will continue to look for creative solutions to retain and recruit frontline workers.